Hi, I'm Morgan, and for my focused assessment, my patient is going to be Josh today. Okay, so Josh, I'm going to start by assessing your head, your face, just kind of eyes, nose, mouth, everything. So starting with your head, I'm just going to start by palpating your scalp. If you feel any tenderness or pain while I'm doing this, you just let me know.
Okay.
Start in the back. I'm going to do a circular motion towards the front. I'm not feeling any masses or lesions as I'm doing this. Did you have any pain or tenderness?
No.
Okay, good. So as I was feeling his scalp, like I said, I didn't feel any masses or lesions when I was doing that. And also as doing that, I was also assessing his hair. His hair is full, it is symmetrical on his head, it's clean, looks like he takes care of his hair. So next I'm going to palpate your lymph nodes. I'm just going to start in the back of your head again. I'm going to feel your occipital. I'm going to do post-auricular, come around the front, pre-auricular, do submandibular, and submental. I'm just going to come back and do your posterior, clavicular, your superficial, and your deep. And I'm just going to palpate your supraclavicular lymph nodes. Okay. As I was palpating your lymph nodes, did you feel any tenderness?
No.
Good. And then as I was palpating, they were all mobile. I didn't feel any masses or any, they were symmetrical on both sides as well, which is good. So next, I'm just going to palpate your sinuses for you. Just going to do your frontal and your maxillary. Any tenderness or pain when I palpated your sinuses?
No.
Good. Okay. Continuing with your head, I'm just looking at Josh's eyes. They are symmetrical. They're even. His head is a good size for his body. It's even. His shape is round. Looking at his nose, I'm going to palpate his nose. Nose is midline. No big deviations. Josh, you just want to test your nasal patency. So I'm going to put one finger on the side of your nose, and I want you to breathe in, and then I'm going to do the same thing on the other side. So I'm going to put you, go ahead and breathe, good. And then on the other side, good, good. All right, so Josh's nasal patent are both patent. His left side is a little stuffy, it seemed like. Since you're smiling, I'm just going to assess your smile. Smile is even. I can see all of his teeth are there. Can you just open your mouth wide for me? Good. I can see your palates are intact. They're pink. His tongue is pink. Oral mucosa is moist. I can see his tongue with your tongue out. Can you move your tongue up and down for me? And side to side. So the tongue is mobile. Good. And then with your mouth, I'm just going to test your range of motion against resistance of your jaw. So I'm going to place my hand underneath your jaw, just push down against with your mouth. Good. And then I'm going to put it on the side. You push against my hand. Good. And then, perfect. So range of motion of jaw is intact. So we're good there. Continuing down your body, I'm just going to palpate your trachea. Make sure it is intact. His trachea is midline, no deviations to his trachea. And I'm just going to palpate your carotids while we're here. I'm going to do one at a time. Good. While I'm at your carotids, I'm just going to take a listen to them. I'm going to listen with the bell of my stethoscope, and what I'm listening for is just always make sure that they are low. While I'm listening, I'm actually going to have you take a nice deep breath and hold your breath, and then I'll let you know when you can let it out, okay? All right, go ahead and take a deep breath. Good, you can go ahead and let it out. Just going to do the other one. Go ahead and take a deep breath again. Good, okay, go ahead and let it out. All right, while I have my stethoscope in my hand, I'm just going to start by listening to your heart. Okay, I'm going to do 5 points. I'm going to start with your aortic, second intercostal space, Go over to pulmonic. I'm listening with the diaphragm of my stethoscope. During a normal assessment, I would listen to each heart point for 1 minute. All right, I'm going to move down to Erb's point, third intercostal space. And go to tricuspid and mitral. And then I'm just going to go backwards and listen to all the heart points with the bell of my stethoscope. Then during a normal assessment, I'd listen to each point for 1 minute. While I'm listening to your heart sounds, I can hear your S1 the best at the apex of your heart, so the bottom of your heart, and I can hear the S2 at the base of your heart, which is a little up higher. So Josh has both S1 and S2. When listening with my bell, I did not hear any S3 or S4 heart sounds, so they're good. Also, just taking a look at Josh's chest. Since he has clothes on, it's a little harder to see any palpitations or anything, but I would see his PMI, point of maximal impulse, at his fifth intercostal space and at the mitral, around the mitral spot. So good. While I'm listening, I'm going to take a listen to your lungs. And then I'm going to start on your front. I'm going to listen to first your bronchial sounds, which is up at your trachea. Just go ahead and take a deep breath in and out. Good. And I'm going to go bronchvesicular. Go ahead and take a deep breath in and out. Good. Another one. Good. Okay, so I'm just going to do your vesicular, your front, lateral, and posterior. So I'm just going to do 6 on your front. I'm going to go lateral. Just deep breath in and out. Good. Now I'm going to go posterior, so if you don't mind sitting up for me. Good. Thank you. I'm just going to do 6 set on the back, too. While I have you sitting forward, I'm just going to be putting my fingertips on your back, and I'm just going to have you repeat the words 99, or the number 99. As each time you feel my fingertips touch your back, I'm just going to have you repeat 99 for me. Okay? All right.
99, 99, 99, 99.
Good. Okay. So what I was feeling for was my tactile fremitus. Your vibrations on both sides were equal bilaterally. I didn't feel any increase in vibrations on one side to the other, so that's good. If you did, it might mean that you have some junk in your lungs or anything like that. While you're sitting up so nice, I'm just going to auscultate, and I'm going to have you say the letter E, and I'm just going to take a listen to you. Okay, go ahead and say E.
E, 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 E.
Good. So as I was listening for your egophony, it sounded, his E came through sounding as an E, which is good. So that's what we wanted to hear. While you're sitting up too, I'm just going to put my hands on your shoulders, and I'm just going to test your resistance, your muscles, my shoulders. So I want you to raise your shoulders up. Good. Do it again. Good job. While I'm also doing that, I'm going to test your muscle strength of your head. So I'm going to put my hand, good, good. I'm going to do the back, good, good job. Let's see, as I have been watching Josh, just breathing normally, as I wasn't asking him to breathe, his breathing is unlabored. He looks like he's relatively comfortable sitting. He's not hunched over. He's not slouched over. He's not using any abdominal muscles to breathe or any contractions when he's breathing. Breath sounds sounded clear all throughout all his lung fields. Didn't hear any abnormal lung sounds, which is good. I think that's it.